My name is Michelle Solomon. I'm a mental health nurse and PhD candidate at Western University in the Department of Nursing, and my dissertation is titled A Picture of Spirituality in Youth Living with Bipolar Disorder. My committee consists of my supervisor, Dr. Fiona Webster, social scientist here in the department, Dr. Parsi Sethi, an associate professor at King's College in social work, Dr. Elizabeth Osech, a psychiatrist and founder and medical director of the First Episode Mood and Anxiety Program at London Health Science Centre, and Reverend Stephen Yeo, a certified spiritual care practitioner at St. Joseph's Hospital. This is the outline of my presentation today. My research question is, how do youth living with bipolar disorder define their understanding of and experiences of spirituality? Bipolar disorder is a mood disorder consisting of extreme highs and lows in mood that can cause impaired functioning and distress. Promoting mental health is a priority in transitional age youth due to the onset of mental illness at this time, and suicide being the second leading cause of death. 1% of Canadians aged 15 years and older report symptoms of bipolar disorder. Psychosocial interventions are critical to the management of bipolar disorder, as pharmacotherapy, although shown to be critical for some, has not been found to fully restore mood and quality of life. Spirituality is a psychosocial factor that has been associated with improved physical and psychological well-being, lowered rates of depression, lowered rates of substance abuse, and suicide rates. It contributes significantly to values and identity formation in youth, helping youth make sense of their challenges. Religious and spiritual struggles are linked to difficulties with mental health and well-being. And over the past 30 years, there's been a disappearance of religion in Canadians 15 years and older, and the adoption of New Age spirituality. The problem is that there is a dearth of literature concerning spirituality in youth who have bipolar disorder. Little is known about how spirituality is defined among youth. The objective of this research is to increase awareness of the youth's understanding of spirituality and to prevent spiritual distress and to support spiritual development, as well as for healthcare providers and spiritual care practitioners, etc., to better support the mental health of youth who have bipolar disorder. The methodology used here is Photo Voice, which is a participatory action research strategy where photography is used to identify and discuss needs of a particular population and create social change. The setting here is Ontario, where we will recruit 7 to 10 youth between the ages 18 and 29 who self-report bipolar disorder, have a device to take photos, and speak English. We are recruiting from religious organizations, psychological services, youth organizations, and through social media. And data is collected through individual interviews that are based on the photos that youth take. Subsequently, there's a webinar to discuss themes, and the analysis is thematic in that we were looking at definitions of spirituality as well as meaning. Dissemination will be through an online art exhibit. Future implications for this research are in education for curriculum development on spirituality to incorporate spirituality into healthcare practices. And in terms of practice, providing or supporting spiritual care across disciplines, specific skills and competencies that can support spiritual health of young people with mood disorders, for instance, spiritual psychotherapy, and policies between youth development organizations, mental health care, spiritual care practitioners, religious organizations that support context, practices, and experiences that intentionally support spiritual development. And also policies for training and multi-faith and multicultural approaches that create safe and respectful environments for young people to explore and cultivate their spiritual identities. That concludes my presentation. Thank you so much for listening.